Hi, I'm Tesiah Coleman. I am a nurse practitioner, lactation counselor, and doula, and I'm the Chief Clinical Officer at Kyndred.
My name is Kimberly Huggins. I am the Chief Learning Officer at Kyndred.
Hello, my name is Brittany Brathwaite, and I am the CEO of Kyndred, and we're here with Ebony. We all have like a story of how we navigated healthcare, but for me, it's like really deeply personal. Both of my parents died before they turned 31. So I've outlived both of my parents, two Black people who had huge dreams and huge ambitions and also gave birth to a beautiful person, me, and a huge life that they did not get to live out because of, and I'm just firmly believe that because of the care they received, their life was taken for granted. There's years and years of systemic violence and abuse and other things that impact how we navigate our sexual lives. And so we built Kimbritive to change that conversation, to have a completely different conversation while acknowledging the injustices that Black women experience. You may have not been able to have those conversations at home, and you may not have been able to have those conversations at school, but Kimbritive is a place where you could have those conversations.
As a team, when we endeavored to create Kyndred, we were told no from the beginning of why are you creating this for Black women? And I think those of us who have the lived experience as Black women, those of us who work intimately with Black women know why this space is needed. We do not have a healthcare space designed for our unique needs. And this is what Kyndred is trying to change in the healthcare landscape, giving Black women a space to navigate your healthcare journeys with affirming care, race concordant providers, and culturally affirming providers.
There just has been a huge overlooking of Black women in the femtech world and the health tech world. We are more likely to suffer from or have complications from hypertension, from diabetes. We're less likely to get pap smears, so we're more likely to die from cervical cancer. And I think for me, like, it wasn't just the fact that so many of these disparities existed, it was also that so many of them were preventable. Because we have all those disparities, we need the healthcare system a lot. We utilize the healthcare system a lot. We are searching for better care. We are huge advocates for ourselves, for our families, but no one was building for us. And so even though I've worked at this point for many femtech companies, I've consulted, I've worked full time, I've built out virtual care teams, even though I've done all that, not one time has someone really considered Black women in the creation.
We weren't able to identify enough spaces for people to go and get like birth control that wasn't coercive, or a pap smear where someone was informing you step by step what was happening, right? Like if you experienced a coercive or violent environment before, you're less likely to go see a doctor. And that's where Kyndred comes in. We're building a healthcare system that is informed by the years and years of knowledge that we have on educating Black women about their bodies, being together and having the conversation together, seeing Black women as experts on our bodies, not just as, you know, people that things happen to, and building a healthcare system based on that knowledge.
One of our signature events at Kimbritive is something called PAPS on Taps, which is our community education event series where we bring Black women together to talk about various sexual health topics with wellness practitioners, healthcare providers. And through that space, we create really an intimate space for Black women to come together to talk about various parts of their sexual and reproductive health journey. For Black women, there are rarely any conversations about sexual wellness that center our pleasure, center our joy. It's usually centered around disease management, deficit perspectives that really frame our bodies as problem sites. And at Kimbritive, our work is really to dismantle that conversation and bring pleasure and joy at the center of those conversations for Black women.
Black women deserve great sex!
I think it's really important as a healthcare provider to make it known that like Black is not a risk factor. It is not being Black. It is racism and the structures around us that are causing these disparities. And so knowing that, I know that we can prevent it. Empowering patients and putting the power back into the hands of patients, into the hands of Black women to be able to advocate for themselves really helps a lot with that preventative piece.
It feels so good to have the work that we've been doing and building over the last couple of months, almost like a year now, to be recognized, to be seen, for people to know about what we're doing.
Healthcare doesn't get a lot of recognition, and there's a lot of incredible Black clinicians and healthcare changemakers out there, and so it's really amazing to just be able to have that be spotlighted.
Yeah, and this has really been a labor of love for us, so to be recognized by our community in this way means a lot to us.
Being a change maker is being abundant, knowing that there's enough time, money, and resources to make the change we want to make.
Especially when you get a no, like to keep pushing forward because you know that this is the change that needs to exist in this world.
Kyndred will be launching soon and we would love to care for you, so join the waitlist.
And join us at Kimbritive at our next PAPS on Tap by going to www.kimbritive.com and make sure you join our waitlist so that we can care for you.
To learn more about Kyndred, visit withkyndred.com.